Now, from WNYT, this is Forum 13.
Good morning, I'm Phil Bailey. Thanks very much for joining us on Forum 13. We want our pets to live longer and live healthier, and maybe we're going to extremes, that we never have before to keep them longer and healthier. We're going to talk about pet therapy, pet acupuncture. Then we're also going to talk about the evolution of cooking in America. It should be a fun show. We're going to start with alternative medicine for pets, if you will, like acupuncture, like pet therapy. We're joined by Dr. Eric Andersen of Ballston Spa Veterinary Clinic.
Good morning, Phil.
Thanks very much for joining us. This is a true statement, is it not? I mean, there are things that your clients want of you, ask of you, that we might not have seen 30 years ago. I mean, we used to kind of think of our pets as, along the lines of livestock, right? We loved them, but, eventually they died. Now it seems like people are asking you to prolong their life, go to greater extremes, maybe greater costs.
Phil, you're absolutely right. Veterinary medicine has evolved just like human medicine has. It's the normal evolution, and I think we've got ourselves, we can pat ourselves on the back for the way we take care of animals. I think it's a good picture of how we treat each other and how civilized we've become.
Because first you were challenged by the pet owners saying, I don't want to let go yet. What can you do? And so you would look, I think a lot of your, isn't that, a lot of your treatments are following the paths of human treatments, right?
Absolutely. I mean, we're traditionally Western doctors. We treat, we diagnose, we use medication and surgery, but there are other treatment methods that are really effective and helpful that sometimes aren't as invasive, and that's what we're going to talk about today.
Tell me about some of the new treatments maybe that might have come as a surprise 20, 30 years ago.
Well, today we're going to talk a lot about physical therapy, and that's a treatment modality that's been used in humans, really started in the early part of the century with human polio patients. And that has become, in the last 20 years, a big thing in animal medicine. Just using all the same methods and principles that are used on humans on animals. Dogs and cats we work on primarily are mammals. Mammals are mammals, Phil. You and I and Lola and Milo are incredibly similar in terms of our muscles and our bones, our skeletons, our ligaments, our tendons. We're almost the same. So there isn't any reason we can't do some of the same alternative treatments on animals that we do on people.
Now, one big difference, if you treat me, I can say, oh, that feels better. If you're treating Lola, unless you're trying to cure a limp, how do you know sometimes if it's actually working?
Oftentimes we are trying to cure a limp, or something that we can visibly see. But as we work with animals more and more, and as we're working with owners that are deeply involved with their pets, they know. This is my assistant Tina. And she knows. She works with these guys every day. She sees them when they're doing rehab. They're coming in 8 or 10 sessions over the course of 3, 4, 5 weeks. She sees the progress, and you can tell that they feel better. And it's not just you can really tell. You know that they're happier, they're wagging their tail more, they're feeling better, they're moving better.
This is what do you call this?
That's Caesar. That's our buddy Caesar, and he's in our Furno underwater treadmill. This is kind of the workhorse, if you will, of our physical rehabilitation program. And Caesar is a patient who's had knee surgery on both back legs. We do a procedure called the TPLO, which is an advanced orthopedic procedure that we do, and he's a breed, a Labrador, that has a fairly high incidence of this happening. It's the most common orthopedic injury we see in large breed dogs. This is an amazing tool because it's got them in the water, so it provides buoyancy so that they can exercise and walk with a normal gait without having all their body weight bearing on the ground. It's also the benefits of the warm water. It's got jets, so we can provide moving water, and those things really stimulate blood circulation and stimulate healing.
I kind of want to trade places with Caesar right now.
Caesar is a great dog, and
pretty good.
Yeah.
Now Lola is Lola a pit bull breed?
She's a pit bull. Yep, that's right. Yep, she came to our practice about 2 years ago. She was found in Bennington after having jumped out of a second-story window with a broken leg. She was essentially abandoned by her owners, and Good Samaritan brought her to the emergency clinic in Latham. They called me and said, "Hey, do you want to fix her leg?" They brought her up, and we fixed her up, and we looked for a home, and we found one at my house. so that's where she lives now. That's how we get all our dogs.
Would you say pit bulls are a misunderstood breed?
They are. They're not to be. They're likewise not to be underestimated. And I'm not a promoter of pit bulls, and I wouldn't have necessarily gone and got one on purpose. But you know, like I said before, she is 99.5% great. The other 0.5% is a little sketchy, but she's really sweet. She's a wonderful dog.
She's really sweet.
She is.
All right. Some of your patients. I mean, are like dogs better than some others? I can't imagine you're doing any acupuncture with fish.
Not so much with fish, but with cats. As far as the acupuncture goes, that is another completely separate alternative treatment method that's being used. And we have had acupuncturists in our practice, Dr. Akawi. He's actually starting his own practice in a couple weeks in Greenfield, and we wish him the best of luck. We'll continue to send patients to him for acupuncture, and again, it's another tool, and it's also a great tool that can stimulate healing in ways that we don't necessarily understand in a deep way. It's more about, you know, but it works.
Now dogs, I'm a dog owner all my life, so I know that they don't necessarily want to sit still if they have a sore limb. I mean, you know, it's pretty hard to tell them just stay for a couple of weeks. And then they have, I mean, I've had any number of dogs with cones around their neck, because if you try to put something on their paw to heal it, all they're going to do is lick it off if they can get at it.
Well, I think you bring up a point that's at the very core of physical therapy and rehabilitation, and that is pain control. Because if something hurts, the dog is going to be uncomfortable. They're going to want to lick that area. They're going to want to, you know, they're not going to be amenable to any kind of exercises or therapy or anything. So that's at the core of certainly an advancement that we've made in veterinary medicine. That's not an alternative advancement. It's a very Western advancement, and that's simply the use and appropriate use of pain medication and anti-inflammatory drugs. Because if you're in pain, you're not going to want to go to physical therapy and do some exercises with that leg. It's just not going to happen, and you're not going to be amenable to getting better and being healed. So that is that's often the very first step.
So what do you have here?
These are called Cavaletti rails, and so some of the early first steps in terms of rehabilitation are stretching and moving the legs. When we have a limb that has been in disuse, it's, you know, you're not using the leg. When you're not using the leg, there is a lot of bad stuff going on in there. Number one, you're getting muscle atrophy. Number two, the joint is stiffening up. It's physically stiffening up, and the longer it stays like that, the harder it is to get things moving. So initially, say after surgery, we're not going to start them on the rails, but we'll start them with some passive range of motion exercise, and we'll train the owners how to do this as well. Maybe scooch Milo over, and we'll just lay Lola down here. Come girl, good girl, sit. Good girl, lay down. Good girl. All right, and we're going to lay you right on your side. Good girl. All right.
Puppy.
So a knee surgery is a common surgery we do. This is the knee joint right here, and after surgery, we want to move that joint. We want to keep that moving, because if it gets stiff, it's going to be very hard to rehabilitate. So we'll have the owners do these what are called passive range of motion exercises. Lola thinks it's all right, and she wants me to do the other side. And we're just going to move. This is full extension, and this is full flexion. And this is also something that at the beginning of a program we're going to make some assessments of. One, we want to know what's our muscle mass. These are her quads or her hams up here on the top of her legs. These are the most important muscles, the quads and the hamstrings, as far as, you know, making that back leg function. So we'll physically take a tape and get a number. Okay, what's the girth of that muscle? So we've got a starting point, and we'll know, are we making progress or not. The other thing we're going to use is a fancy little tool, the fancy name called a goniometer, and that's just a little protractor that we use to measure the joint angle. So I put that knee in full flexion, and I get a measurement there, and I put it out in full extension, and I get a measurement there. And
so you're doing the same thing that an orthopedic surgeon would do if I had, you know, blown an ACL.
Phil, you want to know what? I am an orthopedic surgeon. I'm just teasing. I am. I'm an orthopedic surgeon, and then we've gone on. We are not physical therapists in that we have not done all the thorough training, but we've gone and taken courses, and there are now certification programs for veterinarians in physical therapy. So we're trying to catch up with that, and we're using the same tools that the humans are using. Absolutely, I've had knee surgery, you know, on my own leg, and all these same tools and principles have been applied.
Good. So you can look at my knee after the show.
Absolutely.
Excellent. All right, veterinary. Now, Milo walks through these rails
Yep.
at a pretty relaxed pace. Will any dog do that? I can't imagine my dog.
No, this isn't
just
so
strolling
much,
through these rails.
This isn't so much a exercise like we're running to build up the heart rate. This is to what I was doing on the ground with Lola is called passive range of motion, where she's not doing it. I'm physically moving her leg. As the therapy progresses and as the leg is getting stronger after surgery, then we're going to go to active range of motion, and that's what Milo's doing. And as he gets stronger, we can move, maybe go up to the second rung. I'm not sure if Milo's quite tall enough to do that, but he is physically moving his legs in a full flexion. I mean, that's what we're trying to encourage, you know, because once that joint stiffens up and doesn't have a good range of motion, it's not going to have good function. And that's our ultimate goal, is to return animals to their normal function.
Yeah, well, veterinary medicine has come a long way, certainly. Eric Andersen, thank you very much. Dr. Eric Andersen, appreciate it.
Phil, for your
Tina
time.
Zakarewski, thank you very much. And Milo and Lola, and you are with Ballston Spa Veterinary Clinic. Where are you up in Ballston Spa?
We're right on Route 50, just north of the village, right on Route 50, and we'd love to see you.
Great town.
All right.
Great town. Thanks for joining us on Forum 13. We'll be right back.